So guys, I've been seeing a lot of this APOE or APO. I'm not sure how that's pronounced, if it's an acronym or what, lately in the news. What is APOE? Is this something I should be concerned about?
Yeah, kind of, Jody. APOE is apolipoprotein E, and the one that you're hearing about is probably the APOE4, which is a particular gene that has isoform-specific amino acid differences from the APOE3, specifically at 112 and 158, where there's an arginine instead of a cysteine.
Yeah, that's not helpful at all. How about we roll the intro music, and then let's give an answer that actually means something.
Hey there, I'm Mike.
And I'm Matt.
And I'm Jody. I'm just like you, except maybe not as smart or as attractive, but you know what I mean. I've got questions, but I have an advantage. These guys are two of my best friends who also happen to be doctors who are obsessed with longevity and human performance. So I'm going to ask them my questions. Things like, what's the best diet? How can I live longer and better? How can I get stronger and smarter? All the things you wonder and I wonder. And I'm going to record them. I'll do the work and you reap the benefits.
Okay, Mike, so I'm looking at Jody right now, and he looks scared. And I get it. So I think the APOE is kind of like the shark in like a Jaws movie, or like Freddy Krueger, like when you hear the music but don't see what's going on. I think that's what it's like for a lot of people out there who hear about this really scary thing and they have no idea if they have it or not. So if we could at least explain to people what it is and kind of show them this boogeyman, it is kind of scary. But if you know what it is and you know maybe what to do about it, then I think it's a lot less scary. So could you translate what you just said into English?
Yeah, I can try. I think the what to do about it is a lot easier than what it is. But let's talk about what it is real briefly, just to kind of give everybody some background. So ApoE is apolipoprotein E, and to explain what apolipoprotein E is, I kind of need to talk about cholesterol for a minute. So the body packages fats and cholesterol in these large soluble proteins called lipoproteins. That's why we're talking about apolipoprotein E. The most famous lipoproteins are LDL and HDL, which just about everybody's heard about, right? That's the high or the low density lipoproteins. ApoE is another protein kind of like that, found on lipoproteins. It's on your LDL particles. It's on some other particles as well. It's not the famous apolipoproteins like ApoA and ApoB that we talk about with HDL and LDL, but it sits on the surface of this lipoprotein that's made by the liver. It's also made by the intestines and in the brain, which is going to become important in a minute. And it's got many functions. The two most important ones for this discussion today are, one, sort of attaching to LDL receptors in the liver to clear the particles, as well as clearing amyloid and beta proteins from the brain. And that's what's responsible for the development of Alzheimer's disease, which I think is what we're going to talk about for the rest of the podcast.
Yeah, so those mechanisms in that description, even though that was a better description, I still don't think that's super helpful. I mean, what people really care about is what it does and what it means to them. So
you did mention Alzheimer's, so I'm assuming that is where this comes into play the most?
Yeah, so let me tell you. So ApoE4 specifically is a different version of ApoE3, which is the one that most people have. And the ApoE4 affects the way that the lipoproteins are cleared by the liver, leading to increase in LDL and potentially increased cardiovascular disease. And it also doesn't clear amyloid and beta as well, which increases your risk for Alzheimer's disease and causes an earlier onset of the disease. So basically, if you got an ApoE4 gene, you've got a higher risk of 1, cardiovascular disease, and 2, Alzheimer's disease.
But then the question is how much. So I found out yesterday that my mother is APOE 3/4. So I just had this discussion with her yesterday about what it means exactly. So the baseline risk. So what's the normal APOE? It's 3/3.
Yeah. So
most
people are 3/3.
Did you find this out by blood or DNA, or how'd you find out about your mom?
Yeah, so DNA. So 23andMe she had done, and I showed her how to download her raw file. She sent that to me, and then I uploaded her raw file into Prometheus. Specifically, I wanted to look at her APOE status. I looked at my dad's the day before, and I knew mine. I'm a 3/3, dad's a 3/3, and my mom is a 3/4. So we had to have a discussion yesterday about what that means for for her.
That sounds like a pretty good discussion today too, because 3.3 and 3.4 and might need to be clarified a little.
Yeah, so 3.3, the chance of you getting the disease, of getting AD, that's the normal variant, and that's about a 9% risk. If you're a 3.4, you've got one of those alleles, that's about a 30% risk. That's about 25% of Americans. And your symptoms are going to start maybe in your late 50s to 60s, which is my mother's age, so it made me pretty concerned, and that's why I called her immediately and said, hey, let's develop a plan for you. And then if you're a 4.4, you have basically well over a 50% chance of developing AD, and usually in the late 40s to 50s. So by the time you get to be around 80, I've seen some reports say it's as high as over 90% that you're going to get it. So really
That's
scary.
So Jody, you get an APOE from each parent basically, and your parent has 2 APOEs. So if, like, for example, your parent had an APOE 3 and an APOE 4, you could get either one from them, and then you get one from your dad and one from your mom, and that develops your risk. And the more 4s you have, the higher your risk of Alzheimer's disease and cardiovascular disease, and the earlier the onset, with a pretty dramatic increase if you've got 2 4s.
Gotcha.
And that's why my next call after my mom, and I talked to her, I told her we need to get her mother tested, who's still alive, and then my next call is to my brother, because I know that he's gotten a 3 from my dad, who's 3.3, but whether he got my mom's 3 or 4, I want to know. So he sent his test in yesterday, actually.
Gotcha.
So
it's like a scary treasure hunt.
Yeah, kind of like a scary treasure hunt. But those numbers I just gave you, those risks, that's kind of like if you don't do anything about it. And that's the discussion I had with my mother yesterday. Those numbers, that's not just her chance of getting it. Basically what I told her is, this is your chance of getting this if we didn't know about this, and if you were eating kind of a standard American diet, having a regular lifestyle. But we can, I think, drastically reduce those risks for patients, and that's what I told her. We're going to develop a specific plan for her, and I think that would be a good thing to go over.
So you're saying she's a 3.4.
Correct.
Now, if she lives a cleaner, better lifestyle, diet and such, then her chances could possibly be as good or better than a 3.3, or
yeah. So I think probably 10 years ago we would have not have said that, and I think still there's a lot of physicians today that basically say when you're diagnosed with this, or even if you've got a 4.4, they kind of tell you get your affairs in order. This is going to be a progressive disease. You're not going to be able to slow it down or stop it. But I don't believe that's true at all, because of some really cool research that just came out in the last several years. Dale Bredesen specifically, his book, The End of Alzheimer's, it's a really great book, and he's got case studies showing people have reversal. I mean, the people that can't work anymore are going back to work. People, their scores on their cognoscopy scores are getting better over time. It kind of flies in the face of the traditional wisdom around this.
I mean, this is pretty much the first time in the history of medicine that we're seeing a reversal of Alzheimer's disease. I mean, it on a fairly regular basis. When
you guys started discussing it, I was just like, well, this is going to be a 5-minute podcast. Here's your DNA. Looks like you're going to have Alzheimer's. So
good luck.
Yeah. Have fun with that.
When a lot of people didn't even want to know. A lot of people in the past just haven't taken the test because, I don't want to know. I'd just rather enjoy myself now. And honestly, that was a reasonable thing 5 to 10 years ago. But now I don't think that's a reasonable answer, because we can do something about it.
It is still definitely scary to find out that you've got a 3.4. I mean, to recognize that you're staring disease in the face. And in some ways it's sort of empowering, because I think it gives you the motivation to really get going and start applying some of the things that we've talked about in the other podcasts, which happen to be the same sort of changes that you need to make in your life to improve your risk of Alzheimer's disease. But it's scary. It's sort of it's not easy thinking about the fact that you're all of a sudden have this 3 times increased risk, and you're looking at potential Alzheimer's in your late 50s.
And I think that kind of brings up a good point we haven't even discussed yet, is that when you get your DNA results, I mean, some people don't want to open that email, or whether it comes in the mail, the envelope, whatever, because they're like, well, here it is. I'm going to have Alzheimer's, so, we need to address that. Just roll over when you get these results. Like, it's a perfect opportunity to live a cleaner life, or to make changes, even if it's adding a supplement to your diet, something, be more proactive than just, I guess, reactive.
Well, there's a lot of things you can do. And I think the frustration, and why a lot of people are scared about it, is the data historically, we failed at treating this disease. From 2002 to 2012, I saw this study where they looked at all the clinical trials that were done for medications for Alzheimer's disease, and there were 224 different medications they were trialing, and one of those actually made it to market. So like a less than 1% success rate. Very frustrating. Even that drug was mainly just treating symptoms and slowing things down a little bit, not a big effect. And the reason is pretty clear. There's so many different targets, so many different things that cause this hits to the brain that you really have to take a holistic approach. You really have to address all those things that cause this disease if you want to be able to prevent it or reverse it. So we should discuss that. Like the conversation and the plan that I'm going to have for my mother, we should go over that.
Yeah, and this is also sort of the conversation and the plan that I've got for myself, because I'm happen to be in APO 3/4 as well. So I've been, spending I figured this out about 6 months ago, and I've basically been spending the last 6 months kind of figuring out how to approach this personally and try to apply it to my daily life so that I can reduce my risk, so that I can be at my daughter's graduation and spend my late years with my wife in a meaningful way. So should we talk first about kind of assessing risk in general, Matt, and what we do to assess someone's risk so that we have an idea of what we're dealing with?
Yeah, go ahead. And we talk about personalized medicine all the time, so what we're going to talk about is going to be different for everybody, but the general themes are the same. Just the exact target and the end recommendations are slightly different for different people. So yeah, how would you assess family history and genetics, Mike?
I mean, it's the combination of family history and genetics. So obviously you want to know who's had Alzheimer's in the family, immediate family, and kind of distant family as well, because you can pass down an APOE4, a single one, and not really see Alzheimer's on a fairly regular basis. So you have to kind of get a slightly more extended assessment of family history of Alzheimer's, in addition to specific genetics. And obviously the big one here is APOE4. Like we said, you've got a higher risk with the more 4s that you have. So 1-4 gives you some risk, 2-4s gives you a lot more risk. But then there's also other players as well that can act either in conjunction with the APOE4 or increase other risk factors for Alzheimer's disease. So there's the MTHFR gene, there's FTO and PPAR, gamma and alpha. There's a few other SNPs. There's the TNF SNP that can act with APOE4 and give you a 6 times risk instead of just a 3 times risk. We're looking for all of those things to get kind of a general assessment of the patient's genetics to get an idea of what their baseline risk is without intervention. And then that'll help us not just determine how much intervention we need to do, but also direct our intervention to the specific things that increase their risk. So let's talk about that. So a general approach to prevention and treatment, the really nice thing about it is that it is, for the most part, all of the things that we talk about in terms of being healthy in general. So 1, diet, 2, exercise, 3, sleep. I haven't even said anything here that's like new and different. 4, don't have insulin resistance. 5, treat inflammation. 6, make sure your hormones are optimized. 7, take the vitamins that you need based on your genetics and based on your own personal health. Treat any depression. And then there's things like no-brainers. And I mean, no pun intended there, but like the no-brainers are things like stop smoking, treat your high blood pressure, stay cognitively active. Like, those are just like sort of obvious things that you'd want to do to help prevent Alzheimer's. So if you can attack each one of those things separately, which we should probably go through, I think you've got a really good chance to take your risk back down to what it would be if you didn't have these genetic changes that are increasing your risk in the first place.
Yeah, I remember when I read The End of Alzheimer's, the book, and looked at the RECO protocol, and I was kind of excited in that these are exactly the things that I'm focused on just to optimize my life. I'm not worried about AD right now. I don't have the risk factors, and I'm not that old. But this is exactly what I'm doing, and it's really cool to look at the list because every single one of those things are things that we have talked about. We have either published podcasts or we've recorded podcasts we're going to publish on all of these things. So if you just live a really healthy life, you're going to be way down the road towards preventing this. But yeah, let's get specific. So diet specifically.
So specifically, the general goal for diet is just to reduce your insulin resistance. I think if you can do that, that's your pure Pareto squared right there. I mean that's the majority of the effect is being insulin sensitive. And clearly diet is the best way to do that. Although exercise can benefit as well. There is a lot of talk though about putting people on this Keto 12-3 diet, Keto Flex
Yeah.
12-3.
Yeah, because when you say reduced insulin resistance, that means nothing to most people that listen to this. So so to get specific, Keto Flex 12 diet, which still
That doesn't mean
means
anything to me.
Yeah, it doesn't mean anything.
So we're going to explain.
But we can explain it. But I do want to say up front that you don't have to do this diet. Like, there are ways to improve your insulin sensitivity and reduce insulin resistance without doing the Keto Flex diet. But it has been shown to work in these patients.
Yeah, if you're a physician that knows what that means to reduce your insulin sensitivity or insulin resistance, then do that. If you don't and you want to know exactly how to do that, the Keto Flex 12 diet, I think, is a good one. There are other ways as well, but it's basically a really low inflammatory diet. So speaking of inflammation, I remember seeing a study where they looked at all these patients, people that were 110 years or older, and the only thing they really had in common when they looked at their blood tests were their low levels of inflammation. So this is just paramount in any facet of your life where you're trying to optimize your health. You want to decrease inflammation or chronic inflammation, and this diet does that. So what it means, so Keto Flex, it's a ketogenic lifestyle is how they describe it. You're not necessarily hardcore ketogenic or in hardcore ketosis all the time, but you eat mainly pretty low carbs, and the flex part is a flexitarian. So you may have some fish as well. The DHA in fish and the omega-3s is really important, so it's fine to add that. The 12 part is talking about intermittent fasting, which we've had a specific episode on. So try to have 12 hours between the last meal of the day and your first meal the next day. So if you finish eating dinner at 8 p.m., don't eat again until 8 a.m. And there's some pretty good data, too, that APOE 4/4s or people that are higher risk or further
16
along.
hours.
If they can, if they can increase that window to 16 hours. So if you finish at 8 p.m., you don't eat until noon the next day, which is not that difficult. You can have black coffee in the meantime, like we've talked about. Then that's a much better way to do that. And then
I've been looking at this a lot, actually,
3 hour
because I'm a 4, and it looks like as much as you can push that intermittent fasting or that time restricted eating with ApoE4, probably the better. Because what's going to end up happening is you're going to have that much more ketone production, which, as far as I can tell, is more important for people with ApoE4, especially because you want to make sure you're getting that ketone production from not ingesting saturated fats, which we can go into in a minute. But that makes it a little harder with a keto diet. So intermittent fasting becomes a very important way to increase ketones for ApoE4 patients, which is why you want to push to 16 hours and maybe even start talking about doing some fasting mimicking diets or some prolonged fast.
Well, but a caveat to that is I think that's right for most people, and like everything is personalized. But so if you're talking about an AD patient that actually has it and who are kind of elderly and more frail, then pushing it past that 16 hours, that may not be great just for them maintaining body mass. So as far as you could push it and then still maintain body mass is great. And then we didn't mention the 3 hour part. So no food 3 hours prior to going to sleep. That's a good recommendation in general, but I think it's especially important.
Would it be good for the frail, as you were mentioning, to take like exogenous ketones?
There's actually been a couple of studies on that, Jody. So there was, I saw 2 studies last night. I was looking into this, where they gave exogenous ketones and saw some improved they saw some cognitive benefits in the patients. So short-term stuff. But basically the brain, once you have Alzheimer's disease, loses its ability to use glucose as efficiently for energy. So the presence of ketones will improve the brain's ability to function. So maybe, yeah. I don't think the data is necessarily there, but it's certainly worth it. I think ideally you would get those ketones endogenously from the diet, but if there's a reason that you're having trouble getting there with a diet, exogenous might be a benefit.
But your brain can use glucose or ketones, and ketones is a cleaner burning fuel for it. So it's going to be really beneficial for cognitive function for those patients who already have the glucose impaired utilization as well. So the ketogenic diet, Mike, that obviously with your genetics, you've had some issues with that. So to me, I mean, when I'm advising my mom, I'm going to be talking about bone broth and kind of a pretty standard ketogenic diet. But for you, where you want to really limit your saturated fat, tell us why you do that and how you would approach a Keto Flex 12 that would be different than what I would tell my mom to do.
Well, I mean, honestly, Matt, we should probably pay pretty close attention to your mom and her response to the keto diet as well, because it looks like people with ApoE4 are at higher risk of having that inflammatory response to true ketosis. That happened to me, right? And previously I sort of attributed that to FTO and PPAR alpha and gamma SNPs, but I think it might also be related to the APOE4 itself. And a lot of people are recommending that if you do use saturated fat to get into ketosis and you have an APOE4, that you fairly quickly get off the saturated fat. So stop taking the MCTs and try to concentrate more on monosaturated fats or polyunsaturated fats, specifically omega-3s. So I think anyone with APOE4, I'm going to try to push them towards a higher monounsaturated and polyunsaturated fat keto diet as opposed to a standard high saturated fat keto diet, because I think in the long term that's going to improve not just actually the amount of ketones that we see in their blood, but also their cholesterol response to the diet without increasing the LDL as high as we've seen with some patients with high saturated fat.
So we need
diets.
We need to translate some of those words. So when you talk about monounsaturated fats instead, so first off, you're talking about a bridge. So they can have saturated fats to increase the ketone production, and you were specifically talking about MCT, medium chain triglycerides, pure C8 if possible. So something like a brand name of Brain Octane that may get someone like you or my mom into ketosis and producing ketones quickly, but then you stop kind of using those fats because of the risks. And then you talked about switching to a better source, maybe a plant-based source like an olive oil and things like that.
Yeah, I mean, it's tough because it's so genetic, I mean, like in your mom, Matt, I might not, I might have her taking the MCT oil early with some time-restricted eating to get her into ketosis a little faster. But, for someone young and healthy who's just trying to mitigate risk and say they're 35 years old and they're active, that might be somebody who's really amenable to just fasting for, 24, 48 hours to get into ketosis and then put them directly on that high monounsaturated olive oil, avocado oil sort of keto diet, as opposed to even using the MCTs in the first place. So there's different ways that we can go about doing this. And I think it sort of depends a little bit on the patient that we're looking at.
Yeah, so Keto Flex 12 in general are very good guidelines. Everybody's going to be different. There are other diet things that make a big difference as well. Things like choline. So some people have SNPs that reduce their choline production, and choline is really important for your health, especially brain health. So if you look at SNPs like your PEMT, FADS1, and depending on what you have with those SNPs, you may need to increase your choline.
That makes total sense, Matt. So I just go like pick up some choline in the grocery store, grab a jar of choline.
Eggs. So eggs, organ meat, wild meat tends to have more than meat that you're going to buy at the store normally. Like chicken thighs, like the dark meat instead of chicken breast, and green veggies. So we've talked about organ meat a few times on here, but this is a big benefit of that, especially liver specifically. And if that's just a little too much for you, then just eggs. Eggs are a great source of choline that most people will eat.
You'll get about half your daily need of choline from 2 eggs. So just 2 eggs a day will get you halfway there. And then you add in some green veggies. You don't necessarily have to be running around eating like livers and hearts and kidneys.
There may be some pills. You joked about that, but our friend Peter Canning just texted Mike and I the other day a picture of some pill that he had, which was like, what was it, like ground
organs,
liver and
all kinds of funky organs.
He wanted to get his organ meat allotment without actually eating the organs.
I don't blame him. I'm not a big fan of organs.
I don't know anything about that. It could be an interesting thing to try. I need to look that up.
I think an important thing to mention here too is like we get really excited about the organs, but you can actually get choline, a reasonable amount of choline in your diet without eating organs. You just have to eat lots of veggies and get really some eggs would be very helpful as well. And also other meats have it as well. Like salmon has a decent amount of choline in it, and even some legumes have choline in it too. So there's ways to get this. You just have to be sort of cognizant of it. And if you are vegan, it probably makes sense to be either eating that ground up organ pill that Peter found, or just taking some straight choline.
Pretty sure ground up organ pills doesn't qualify as vegan still, but I don't know.
It's a good point.
I'm not the vegan police, but there are other things as well. So antioxidants, that's going to be important. What are the SNPs like FOXO3,
CoQ10?
Depending, everybody should get antioxidants and good food sources, but some people are going to need it more than others if they have lower activity and production. So what would you advise for people when it comes to that?
The biggest thing is probably just high antioxidant leveled foods like blueberries and sulforaphane from broccoli sprouts. I mean, that's pretty much the two main things that I concentrate on when I'm trying to focus on increasing the antioxidants in my diet. There's obviously lots of other places to get antioxidants. You can also just take them. So you can take, the liposomal glutathione, you can take NAD, you can take NAC, you can take vitamin C, lots of vitamin pills that you can take for antioxidants, but also just really concentrating on high sulforaphane foods and blueberries, I think, is a great place to start.
Yeah, we've talked about how we take glutathione, NAD, and vitamin C in very specific circumstances, so hopefully people have heard that. And then polyphenols. Those activate SIRT1, which seems to counteract some of the effects of APOE4. So polyphenol, we've talked about coffee. I mean, coffee's a perfect source for that. There's not a better source than coffee for getting your polyphenols. And
you can also just eat curry, which is kind of amazing to me, that just having like curry in your diet is gonna affect your Alzheimer's disease risk. But they've actually done studies in patients who have high curry diets, and they have a lower risk of dementia, which is pretty amazing. And the reason is because of curcumin. Curcumin comes from turmeric, which is that spice in curry that makes it yellow. And you can either just eat curry, or you can actually take theracumin, which is a type of curcumin, basically. It can improve the amount of amyloid and tau that sort of collects in your brain and reduce it, which has that effect of reducing your Alzheimer's disease risk.
So we've talked for quite a while, and we could double the time we've talked on nutrition. But Jody, are there any clarifications you think that we need when it comes to nutrition? Everybody's going to be different. It's going to be personalized recommendations for everybody, but the things we talked about are the big generalizations I think we could
Yeah, I mean, nothing here sounds crazy. I mean, all these words that you're throwing at us, like, curcumin and a couple polyphenols, maybe some stuff we haven't heard, but I mean, everybody's heard of eating eggs and coffee. So I think, maybe just a list of things, blueberries and those kind of green veggies and such, that makes it simple. Maybe I don't care so much what's going on behind the scenes on each of those things, but it'd be nice to have a list of foods that can help, and that seems to be there. So
yeah, and the kryptonite is probably important to talk about, and that's just basically what you would expect for an AD patient. It's going to be sugar, and then obviously vegetable oils for everybody, but sugar, that's just like lighting a fire, and that inflammatory process is going on in the brain.
So you want to bump it to the next thing after diet? You want to talk about exercise?
Yeah, so exercise, of course, as you would imagine, Jody, is crucial. It's been shown in...
Actually, right before we go into exercise, we should have a follow-up podcast specifically on the microbiome. It relates to the nutrition part, and I just had a meeting about an hour ago with one of the leading researchers in the world on AD and the microbiome. So we should talk to them about this because it's really connected. You may have seen the study in Nature a few months ago about the microbiome and the ketogenic diet and how it can have a big role in treating AD, increasing cerebral blood flow in this mice model. And they're going to do some studies in patients. I'm really excited to talk to Dr. Lynn more about that. So we'll get into that on a follow-up episode with them to really dig into the science on that. But the microbiome, just so you know now, is important in AD. And actually, just one more thing about nutrition. I said we needed to move on, but how you cook the food, I think that's important as well. People don't realize this, but we talk about AD being an inflammatory disease a lot of times, not always, but frying foods makes foods more inflammatory. And we've talked about char grilling and the blackness that you get on food. That's carcinogenic, so you want to avoid that. And then aluminum. So that's not great for your brain and can kind of accumulate. So cooking in aluminum foil or pans that are aluminum, you probably want to avoid that. And it may be worth investing in some clay pots and pans that generally work by steaming, but it cooks your food in a cleaner way, or an Instapot even. I think those are popular. A lot of people have those. There's not a lot of data on the aluminum stuff, but I don't see an advantage to using it. So just avoid it if you can, especially if you're at risk. So sorry, now exercise.
So deep fried cauliflower is probably not the best way to take in my veggies.
Not really, no.
So Matt, you just recommend people just take their clay pots and cook them over like a campfire in their backyard? Is that the...
Toss out the plant and dirt.
Yeah, it's a little dirt in there for the microbiome.
They put some dirt in there, a couple mushrooms you don't wash off. Let's talk about exercise before Matt starts telling us to buy some more clay, build our house out of clay. I think exercise is totally crucial, Jody. It's been shown in multiple studies to delay, could even prevent the development of Alzheimer's disease. And I think that's happening for a couple different reasons. One, if you exercise, you're likely going to have a better body composition, and body mass index, or basically how obese you are, has been directly related to Alzheimer's disease. But exercise itself can reduce your insulin resistance. So the same thing we were talking about.
The bigger the gut, the smaller the brain volume. That's actually been shown. No, I'm serious. Like, that's been shown in studies. So I think it's just a good picture for people to imagine. You make your belly smaller, then your brain.
Yeah, if you're feeding your belly, you're not feeding your brain. But then also,
it's like a balloon animal when you squeeze the fat part, and
it's almost exactly like a balloon animal. Yeah.
But also reduced insulin resistance. So we were talking about this with diet, but you can also reduce your insulin resistance with exercise, which is super important. And then also specifically, you can actually decrease some of the chemicals in the brain that lead to Alzheimer's disease through exercise, and increase some of the chemicals in the brain that are protective. So specifically, you can decrease glutamate and you can increase BDNF, which are both really good things for Alzheimer's. So in general, I'll really accept any activity when it comes down to it, but ideally at least 30 minutes or more per day. And I think there's probably significant advantages to both lifting heavy weights and actually doing aerobic exercise. So probably do a mixture of both.
Has this been shown in people that are trying to delay or prevent Alzheimer's compared to people that already have it, like exercise?
Yeah, well, that's a difficult question, Jody. So with AD, when we've tried to break it down and study one intervention, nothing works by itself because there's just so many targets you got to hit. So this has been shown, the things that Mike talked about, the decreasing glutamate, increasing BDNF, we know those things are important for brain health. So this is one of the pieces of the puzzle. So when you say, has it been shown? Well, not by itself necessarily.
Let me interrupt. It kind of has been shown. There was a study in patients. It was an epidemiologic study. So granted, the data is not great, but it was in patients who were APOE4 carriers, and they looked at people who were physically active with APO3 and patients who were physically active and weren't physically active with APO4. And they basically found that if you were sedentary with an APOE4, you had a 5.5 times risk of Alzheimer's compared to an active person with APO3. So there's a fairly significant increase, even above that risk that we assume for APOE4 of 3, of a 5 times risk if you're sedentary and have an APOE4. And they found that basically that risk was reduced in half just by being active. So yeah, I mean, I think there is some data to suggest that you can basically help prevent the progression of this disease, or even getting it in the first place, by being active, most specifically in your middle-aged years. So 30, 40, 50 is when probably this is going to be the most important.
Well, I think exercise is probably the single biggest predictor of longevity and brain health just in general. So it's obviously important. And the main thing is just to be active. There's some activities that I think are better than others for certain people. Again, it's all personalized. The lifting weights, so especially for older adults, you really start to lose muscle mass every year after 30 years of age. And the amount of lean muscle mass somebody has when they're over 60 is a really strong predictor of longevity. They've done specific studies looking at leg strength and longevity and correlated that. So lifting for sure in these older patients. Yoga, it's a perfect workout for somebody in my mind who has AD because it increases balance, strength. Both of those, especially for an elderly patient, the balance and strength are going to be important just for preventing falls. I mean, concussions and blows to the head or just breaking a bone. And then the stress reduction. Stress is really vitally important to optimize an AD patient in general, really anybody, but an AD patient specifically. But when I say just be active, I do want to, I guess, throw a caveat in there. If you love cage fighting or playing football, maybe that's not the best activity if you're a 4-4 or a 3-4.
Is cage fighting considered exercise?
I think it's probably pretty good exercise. And obviously it's we don't think any of our elderly AD patients are going to be cage fighting. But I mentioned this.
They might be matadors.
Maybe matadors, you never know. But I mention this because we know patients now who are young, who are 3-4 and 4-4, and although you're nowhere close to getting symptoms yet, I mean, I played college soccer and I've gotten knocked out a few times playing soccer and basketball and baseball, all those sports I've gotten knocked out in, and that increases my risk later. And so, I mean, honestly, if I got a kid that's 3-4 or 4-4, I'm probably going to have them play tennis or golf or something that they're not going to have any blows to the head, because it's a pretty clear risk factor, especially if you've got the genetics already. I'm not sure it's worth taking the chance if you've got those genetics and playing one of those contact sports.
Yeah, talk to us about running, Matt. So you and I have done quite a bit of running in the past. We've both done some ultra marathons, and I think in general, we've come to the conclusion that running, if you do too much of it, can be bad for you. But it sounds like with Alzheimer's, that might not be the case. Maybe there is a certain amount of running that's good.
Well, I don't know if you've heard this before, but everything's dependent on the person. Yeah, sorry to say that like 100 times.
You know, I'm different than you guys.
So specifically with running, so yeah, you and I don't really run that much anymore, and we have our reasons for it. I think part of it is that we're type A people, and we just take it too far, and that chronic inflammation is not a great thing for us. But somebody with AD who's inactive otherwise, I mean, running is really great exercise. There's glutamate you mentioned earlier, so running has been shown to clear that, and glutamate's an excitatory neurochemical that can be damaging to the brain. And the fact that running clears that and that it increases BDNF, which you just mentioned a little bit, that's a really good thing. And most people aren't going to take running to the level that we did, and so I think it's a great recommendation for somebody. It's so simple. You get a pair of running shoes. You don't need weights. You don't need anything else. So I think it's a good recommendation for those people. And then the exact recommendation is to the ratio of maybe like strength versus endurance or running things. That changes. I mean, it changes daily if you're somebody that we're taking care of, because we track our daily activity and our strain via our Whoop devices and Oura rings, and so we know each morning like how ready we are, and so we may tell somebody to work out harder or less hard depending on what your heart rate variability was that morning. So you could get really personalized with these recommendations as well. But running, I think, is a good recommendation in general for people.
That's one of the most interesting things about having these devices now, like the Whoop and the Oura Ring, is that, previously I used to write out my workouts for the entire week and just do them no matter how I felt. And now I regularly wake up and, check on my recovery, and maybe subjectively I don't feel well, and I look at my data and I'm not recovered. I'll actually change up my workout or not work out, which is a totally new thing for me. And that's a really interesting way that these devices have changed my interaction with my exercise.
Yeah, I actually skipped a workout last week when I woke up and my heart rate variability was 52, and I would not have done that in the past before tracking. I remember doing workouts when I had a fever of 101 before, which is really dumb. So yeah, it's been a total game changer for me as well, being able to see what my sleep was the night before and how ready I am to perform that day.
And sleep is really important for several different mechanisms for Alzheimer's disease. So first off, during sleep, you're fasting, which we already said is a good thing, right? So if you're sleeping, you're not eating, and it's good to spend time not eating. But also during sleep, your brain cells, they kind of eat themselves, which I know sounds bad, but autophagy, which we've talked about on the podcast before, is a good thing for Alzheimer's disease. And spending that time during sleep with your brain cells kind of eating the broken down components of themselves gives them a chance to kind of regenerate. But also, you have this opportunity during sleep to flush out cellular debris, some of the crap that builds up sort of in between the cells. And if you don't spend that time at night sleeping, then your brain doesn't have that opportunity to kind of regenerate. So sleep becomes extremely important, and just like it is with every aspect of life, I feel like these first three things that we've mentioned are like the first three things for everything you do for health, right? It's like, diet, exercise, sleep, those three things. It's no different for Alzheimer's disease. We've done specific
podcasts on these things already to optimize them, and I mean, honestly, if you just listen to those podcasts and follow those recommendations, then you're going to be optimizing these things.
And I cannot say enough. We should do a whole podcast about these sleep devices, because I cannot say enough about how much they've changed my approach to my own personal sleep, in terms of figuring it out, learning about how I sleep, learning about how to get better sleep, affecting my sleep hygiene. We really need to do, an entire podcast on these for sure.
Yeah, and we don't want to act like you have to measure it and things to really get good at it. But I mean, what you measure, you affect. I mean, for us at least, it's had a big impact. I mean, really seeing your sleep architecture each morning when you wake up is a cool thing, because you do different repair mechanisms and things during different cycles at night. So you don't have to get a sleep tracker. I mean, you can optimize your sleep otherwise. But if you're having trouble with sleep, I think it could be a really useful thing for you. And I think maybe especially somebody at really high risk with AD, I think it would be a nice thing for them to do, to really not just guess. I mean, when you see a patient in a follow-up and you say, how have you been sleeping? They say, good. That's not very helpful. Right. If you have their data and you see how many hours they were and how much deep and how much REM and all of their architecture, then that's helpful, and you can make some recommendations and adjustments based on that.
And I think it's helpful in the short term for the patients as well. Like, I'm not saying that everybody needs to wear an Oura Ring or a Whoop device for the rest of their life, or a continuous glucose monitor, or, use a ketone meter every day for the rest of their life. But I think using these devices, even for a short term, really gives you a lot of insight into, how your body responds to certain things. And it allows you to develop some behaviors that sort of optimize those things. So it's not like you have to wear that ring for the rest of your life, but you wear it for a couple months, you figure out how your body works, how you respond best. And then, if you want, you don't wear it anymore and treat yourself subjectively. And I think the same can be true for, a continuous glucose monitor, a ketone monitor, or any one of these sort of devices that we use to optimize.
Well, you said you saw how alcohol affects your deep sleep so poorly. So if you took your Oura ring off and never wore it again, you're going to drink less alcohol because you know what it does to you. So yeah, a short period of time gives you really useful information into your physiology.
I guess the only exception would be something that doesn't it's hard to correlate, because I would say with your sleep devices, a lot of times you're cognizant, I didn't have a good sleep last night, and then your device confirms that. So sometimes if something doesn't line up, that's what you may need to focus and learn to kind of, find the pattern that matches or doesn't match.
Well, I think the data is just motivating too. I mean, like I mentioned earlier, like doing a workout when I had a fever in the past, I knew that was not a good thing to do. But when I have the objective data of my heart rate variability is 52, then that's enough for me, because I'm a data-driven person, to actually make the change. So even though you may not get great information, if you wake up and you haven't slept good, if you haven't slept good. But seeing it, for a lot of people, I think it's going to be motivating enough to make changes. I mean, people know how they feel after they drink, but having that feeling and seeing your deep sleep tank is maybe enough to actually push them to not drink as much or change their habits. What else about Alzheimer's, though? I mean, we could talk about those devices forever.
Well, next is insulin resistance, which is mostly already been covered in diet. Because generally we're going to approach treating insulin resistance with diet, but also there's other ways to do it too, like exercising, cardio and weight training, like we mentioned. So it's kind of covered in two as well. But then I don't know if we specifically mentioned it, but you've got to limit your refined carbs. And if people are still having trouble with their insulin resistance, after modifying their diet, adding exercise, that's when you start talking about actually adding some medications and some supplements to try to improve insulin resistance. But this is something we're going to specifically test for, looking at your basal insulin, your hemoglobin A1C, your glucose levels, and make sure that this is as optimized as possible, because I think in terms of body markers, this is probably one of the most important for the treatment of Alzheimer's disease risk.
Yeah, and we also mentioned inflammation already, but just to hit on that, you mentioned the refined carbs. That's going to cause more inflammation. So some other things that you can do to reduce inflammation other than the Keto Flex diet is think specifically about gluten sensitivity or other causes of leaky gut. That's going to lead to more inflammation. So decreasing your gluten intake, your omega 6-to-3 ratio, which we've talked about specifically in our fish oil podcast. You want to optimize that. Oral hygiene can be important. Chronic inflammation from things like mycotoxins or Lyme disease. You may need to get your house tested for mold. And then the heavy metals. I mean, that can be a source of inflammation in general, but just toxicity also more than inflammation. So if you're having trouble and you're optimizing these things and things aren't getting better and you haven't tested yet, you probably need to get tested for heavy metals and see if you need to go as extreme as some chelation therapy, or if you have really low levels, maybe some sauna and some other detox methods may be good enough for you. And then hormones. Hormones are a really big topic.
Yeah, this is a really tough one. I mean, hormones are super complicated, but unfortunately they're closely involved with the development of Alzheimer's disease. So I think for everyone, the first thing to check is thyroid function. And unfortunately, this is a little bit more complicated than just looking at somebody's TSH, which is the typical lab test that's ordered. You really got to look at people's T4, their T3 to reverse T3 ratio. You got to dive pretty deep into the thyroid hormone to figure out exactly where people are and to optimize them. And for women, obviously, we're going to be looking at not just estradiol, but also the estradiol to progesterone ratio. In men, we're looking at testosterone, but then also we're looking at some of the stress hormones like cortisol, DHEA, pregnenolone. It's really a good place actually to talk about stress reduction in general. Stress has been really intimately related to Alzheimer's disease. So I think it's really important that you treat your stress as best you can with really easy interventions, like Matt mentioned yoga earlier, but also meditation on a fairly regular basis. That can really lead to some significant cognitive improvements and can, I think, also decrease your Alzheimer's risk.
I'm not sure we can stress just how important hormones are for really everything. When we live in a toxic artificial environment too, which is what's frustrating, that is really perfect for disrupting these hormones. So you can listen to our testosterone episode that we already recorded, but it's really important. And it's not just about testosterone, though. It's about the ratios and the balance of your hormones. We want to optimize free T3 and free T4 and estrogen and progesterone and pregnenolone and cortisol. All of these things need to be looked at and balanced as well. There's a specific subtype of AD called the cold type that's less about the inflammation and more about hormone imbalances. So I think a lot of people know about estrogen and how imbalances can lead to increased risk of breast cancer, but it's just the same for AD. I think it's like 65% of AD patients are women. And personally, I don't have data on this, but I think that's partly due just to the poorly balanced estrogen levels later in life for a lot of women. So it's a difficult issue. And choline, which we mentioned earlier, that's a risk factor that works through estrogen mechanisms as well. So remember, for women especially, it's probably important to optimize that through your diet with the eggs and the organ meat and the wild game and all that. And then once you've got your hormones optimized, though, vitamins are also really important.
Yeah, lots of different vitamins to go over here. This is a long list. So vitamin D, methylfolate.
Yeah, if you're deficient in vitamin D, which is a very large portion of the population, we'll add a supplement and optimize for that. And if your omega-3 levels are off, we're going to fix that with diet or supplements. And I think when some people hear us talking about optimizing performance, they think about CrossFit bros increasing their deadlift and their 5K times, but optimizing an AD patient so they can dance at their granddaughter's wedding and remember it is exactly the type of thing that really gets us up in the morning. That's the performance optimization that we get really excited about.
Yeah, I couldn't agree more. A lot of these vitamin optimizations, because they're so personalized, are going to require a lab test as too. So we can kind of get a sense of what to focus on with genetics. Like, for example, with the MTHFR mutation, that allows us to focus on folate and B12, B6 because you're at higher risk of having elevated homocysteine. But a lot of the other ones are going to require specific tests to actually see where you sit normally and then optimize from there. So, Matt mentioned vitamin D, also B12 and folate, magnesium, selenium, copper to zinc ratio has been found to be important, thiamine, vitamin E.
Yeah, you don't need to remember all of these. You can write these down, but there's just so many. I mean, there's Bacopa. I don't even know if I'm saying that. I've never heard it say. I've just read it. Lion's mane, which I take daily. It increases neurogenic growth factors, good for normal cognition, enhancing that as well. Glutathione, vitamin C, NAC, we've talked about all those. ALA, just to optimize your antioxidant levels. CoQ10, resveratrol, PQQ, all of these things, there's a big list. Resveratrol, which we mentioned a few times, is going to increase your SIRT1, which we already mentioned, kind of offsets or works against the APOE4.
Is that what's in red wine?
Resveratrol is in red wine, and that's why people get excited about drinking red wine, but such a tiny amount that doesn't actually have a clinical.
I thought that's where I'd heard that.
And if you actually look at the risk of Alzheimer's disease with alcohol consumption, if you've got an APOE4, it's several fold higher. It doesn't affect APOE3 people as much, but alcohol is probably worse for people with APOE4.
Alcohol is toxic to the brain. It just is. And people. So it drives me crazy if I see people thinking about drinking red wine for the resveratrol for AD when the alcohol is going to be much more negative than the resveratrol.
It's probably just a brilliant wine marketer.
Yeah, no, it is. Yeah, I think they were a lot. They had a lot to do with all those research studies.
The wine market went up like 30% after that study came out.
I bet.
Although I will say with resveratrol, we talk about how small the dose is in red wine compared to a therapeutic dose, but I don't like to talk about things in those terms anyway. I think resveratrol in a whole plant-based form, grapes and red wine, is probably better than just a pill form anyway. So there are probably some molecules that interact, and so I don't want to say there's no benefit to the resveratrol in red wine or whole foods. But it's overplayed, and it's more toxic to your brain than helpful to drink red wine. It just is.
So would this be good there's a ton on this list you've mentioned. Would this be good just to do like one of those over 60 vitamins that you buy? I mean, I know majority of this you want to get out of your diet, but a lot of people...
That'd be a big pill.
Yeah, I was just say probably not. I mean, you could bring us the pill and we could look at it, but no, I think this needs to be something. This is complicated. You're not going to remember all this. This is something that you sit down with your doctor and talk about, and you go over your levels of everything, and then you pick and choose each thing, because some of these things that's expensive too. I mean, you have a big list of these supplements that adds up to a lot. It's a lot to take in the morning to remember. It does be hard for me to remember, much less a patient with AD.
Yeah, a lot of these, Jody, we're describing. We're going to test the levels before actually administering the vitamin. So this isn't a list where you should take every single one of these. This is, you should pay attention to it and maybe take that vitamin based on what your magnesium level is or what your vitamin D level is, right? So
that's what we needed to hear, us lay folk.
Common man.
Our common peeps. We don't need this list of stuff that's acronyms and
all right. Well, I think the only things we didn't really mention yet, I think are important, is ashwagandha can reduce amyloid beta activity, DHE, EPA, which we've talked about those, reducing inflammation before. So we mentioned the microbiome, so prebiotics and probiotics are potentially helpful if you've got gut microbiome issues. And then
getting back to
sauerkraut. Exactly. And then,
so let's get back to it. Let's get back to our list of things, of interventions to do. And I think one that we should probably talk about is depression and stress. Studies have pretty regularly shown that depression increases your Alzheimer's disease risk by about 2 times, which is a pretty big deal. That's almost as bad as having a single APOE4 variant. What's clear, though, is that depression really does need to be treated to help reduce the risk of Alzheimer's disease. I mean, obviously, depression is horrible in itself and needs to be treated because it's horrible. But people with a history of depression need to be extra vigilant about modifying their other risk factors for Alzheimer's.
And that reminds me of the one kind of supplement that I didn't mention I think is important, is like some tryptophan, potentially melatonin. Depression and sleep are really related in general. And a melatonin supplement, while we may not recommend it for the general population, the benefits of that related to improved sleep could be really helpful. And then you mentioned earlier, Mike, there's some
I think
no-brainers.
Well, but before we go there, I think with the melatonin, I think I'd like to specifically try to decrease like blue light and some general sleep hygiene first to see if the body can produce its own melatonin. But yeah, you're right, Matt. If you can't produce your own melatonin and you can't get to sleep, then there is some definite advantage to melatonin. And if you're having those awakenings in the middle of the night, then tryptophan might be beneficial as well. And both of them are fairly low risk as far as we can tell.
And we know that as you get older, your melatonin production decreases as well. So these patients specifically are probably going to need melatonin, or probably going to be helpful if the natural ways aren't enough.
Yeah, just to complete our list, we talked about the no-brainers. And those are the pretty obvious things, like stop smoking. So Jody, my recommendation on smoking is to stop smoking. That's all I got.
That's clear cut. I like it.
For hypertension, you just treat the hypertension. I think that's something we don't need to go into on this podcast. And then also stay cognitively and socially active. I think that's super important.
Yeah, I mean, we've seen over and over in a lot of studies that makes a big difference. It's hard to know. We think it's important. When you look at the studies, there's significant confounders with this in these epidemiologic studies, which say that staying mentally active helps defend against AD, because basically the people who have early AD or dementia are more likely to become less cognitively and socially active. So what comes first, we don't know. But either way, there's nothing but benefit from staying cognitively and socially engaged until the day you die. I think that's what we all want to do.
Yeah, I mean, I truly believe that continuing to challenge yourself is important in every aspect of life. I mean, whether we're talking about exercise or cold immersion, diet, and that applies to cognition and social interaction as well. So I try to challenge myself every day not to be a jerk specifically.
Yeah, you probably need to work a little harder on that in general.
So Jody, you already told us that your APOE status is APO3/4. So like we've talked about before, that puts your risk of Alzheimer's disease somewhere around 30% without intervention. And that's definitely higher than the rest of the population. It's about 3 times higher than the rest of the population. So the APOE means a few things. First, you've got this increased risk for Alzheimer's disease that we've spent this entire podcast talking about, but you also are likely to have higher cholesterol. So we're going to need to check that. We're going to want to try to get your LDL-P below 1,000 without shutting off cholesterol synthesis in your brain. So we're going to need to check and make sure we don't do that by looking at your desmosterol. And we're probably going to have to put you on a combination of either a low-dose statin or Zetia, or maybe even consider another medication to decrease your cholesterol. Now, you do have a SNP for increased myopathy. I saw that in your genetics as well when you take statins. So we're going to have to pick a statin specifically that's got a lower risk of causing that myopathy. And you're probably not going to tolerate a ketogenic diet as well because of the APOE4 status and because of some of your other SNPs. So we're going to need to be really careful with saturated fat intake. We'll probably use it to get you into ketosis, but then after that, I'm going to want to try to decrease that and increase things like extra virgin olive oil, avocado oil, things like that.
So I didn't actually look at Jody's genetics yet, but what about other things? Like, did you look at his MTHFR and PEMT?
Yeah, I did. So he's got 2 gene mutations that put him at risk for low folate and elevated homocysteine. Both of those are risk factors for dementia. So we're going to need to check his homocysteine levels and treat those based on how high they are with either methylfolate, methyl B12, and also look at his blood levels of choline, because your choline can get elevated if you have those things. And choline actually helps convert homocysteine back to methionine as well. So we want to optimize that choline level. Jody, you should be eating lots of eggs. Ideally, throw in some organs.
I'm already all about them eggs.
or supplementing with choline itself.
Yep. So I know you got chickens.
Yep.
I'll bring you some. I've got some frozen liver for you. We're gonna set you up there. Mike, what about his FTO?
Real quick.
Yeah.
So I know skin is the biggest organ, and I eat the chicken skin when I eat chicken. So am I doing pretty well by eating? Is that organ meat?
I guess technically, yes. We did a podcast talking about which organs have the highest nutrient density, and it's liver's number one. So
I eat those eggs.
I literally do have some frozen liver.
I eat very little
skin
chicken
is technically
itself.
an organ. I don't know. I don't think it counts for organ meat. Jody, so you've also got a couple other SNPs that alter your ability to manage saturated fat. So like I mentioned earlier,
thank you.
So like I mentioned earlier, we're going to have to be real careful with your saturated fat intake, because not only can it lead to increased cholesterol, but it can also increase your risk for diabetes and insulin resistance, which we said was like one of the main players for Alzheimer's disease. So again, really try to decrease the amount of saturated fat in your diet.
What about BDNF? Did you look at that?
What was that one again?
So BDNF is really beneficial in your brain. What was Jody's results?
He's got a SNP that reduces the activation of BDNF.
So this is not going great for you, Jody.
Yeah, it's a little downer here.
But I mean, so there's some things we do, and we already talked about those, like lion's mane. Like I will literally bring you some. I guess we're not harvesting it right now, but I've still got some frozen, and then there's those packets. I've got in my backpack. I could give you some right now. So that's going to increase that.
Yeah, Matt said it's not going good for you, but that's not true. You've actually got some good SNPs. So we just went over the ones that are actionable, and now I can tell you about the ones that are good. So you've got a normal transferrin gene, which is good. That's going to reduce your overall Alzheimer's risk. You've got a normal SIRT1 gene, which has been shown to help reduce Alzheimer's risk, and you've got several normal lifespan genes, which mean you're more likely to live a normal lifespan than other people, which is nice. And
these genes, I mean, people used to think that these genes were your destiny. I mean, these can be kind of turned on and turned off. I mean, epigenetics and signaling. I mean, that SIRT1 we can enhance that with nutrition, like we already talked about in the podcast.
Yeah, SIRT1's going to get activated by fasting. It's going to get activated by multiple different supplements that we're giving you, as well as the resveratrol. I mean, so you can really affect these genes based on just your approach to your daily lifestyle.
So let's summarize. Our goals with you, Jody, are going to be, we're going to optimize your diet. So low glycemic, low inflammatory, low grain, Keto Flex 12 diet. What questions do you have about that?
I mean, none, I don't think. I mean, it seems like everything you covered under the diet portion earlier pretty much answered any questions I had. I mean, it seems kind of like
you understand
it should
how
almost
to
be bumped down to the no-brainer. I mean,
gotcha.
It's just like a healthier diet in general.
You've talked with us about this plenty of times. So ketogenic diet, and then but the 12 hours between. I mean, you're already doing like 16.
Keto Flex is new, but it just seems like a trendy name for it. I mean, it didn't sound like anything was.
And then not eating 3 hours before you go to sleep. So 12 hours between meals. Perfect. All right.
And then we need to reduce your stress. So Jody, how's the meditating going?
Yeah, so like I'm sold on the meditating. That's probably the favorite thing I've tried in the past 2 years.
Whoa.
Like I'm a devotee trying to figure out.
If
How to
you haven't
step up my game
seen
even
Jody
further.
meditating with a Muse device on while sitting in a sauna, you should definitely follow
Yeah,
us on
you need to check out the
Instagram.
Instagram
It's one of the
account.
funniest pictures I've ever
That's
seen.
hilarious.
At Wild Health MD.
Yeah, at Wild Health
Instagram.
MD is the account, so follow us on there to see
It's
funny pictures of Jody
Most
meditating.
ridiculous thing I've
I
ever.
love
And you
it.
said that thing got up to
Uh,
140 degrees. Is that right? It's like a portable sauna.
The portable sauna, yeah, and it's all infrared. So
Yeah, we
it's-
didn't mention that in our sauna episode,
Yeah.
but this thing is $250, and Jody's
Man,
been
I'm gonna
testing
get
it.
one of
No,
those
no.
things. I'm gonna put
Well,
it in
it's less than 200. It's like 170.
Okay,
80.
so follow us on Instagram. Jody will link to that to show you where to get that. But yeah, you can get the effects of sauna pretty cheaply at home if you're interested in that.
Yeah, it folds up. You can take it anywhere.
All right, so you've been
At Wild Health
meditating daily, Jody, every few days.
Yeah, and I've found like the Muse device is so helpful. And, I mean, they're not a sponsor or anything like that on here. I mean, it's just something that we had.
Is that because we
I
don't have
actually-
sponsors?
I actually borrowed
Yeah.
it from Matt. Like, it's not even my Muse device, but it's been amazing. Like, I pick my kid up from school sometimes, and I'll just sit there for 10 minutes and meditate in the car.
While driving?
No.
Oh, okay.
Well, once.
Okay.
Once only. No, just sitting there in the car, it's like you're not doing much anyway. So 10 minutes is nothing, and it goes by really fast, and it's been just nuts.
Well, we
I
mentioned
feel like-
yoga and the stress too, but I think one thing that just a quick pro tip for people, getting bite-sized doses of meditation and things like yoga. I do this like when I'm on shift in the ER. I don't have time for a 45-minute yoga session, but when I can still 3 to 4 minutes somewhere and do a few
You
poses.
just go in the bathroom and do some downward dog. Is that what you do?
That's actually exactly what I do. But yeah, I mean, you do that like 10 times over the course of a day, 3 minutes each, and you're going to get